Kyle and Joe. How are you doing today, Kyle?
Doing pretty well. How are you doing?
Good. Happy Bicycle Day. We made it.
We
Another
did.
year. Another year. Yeah. So last year, what were we up to? I was at the San Francisco Bicycle Day event at the Midway. It was pretty fun. Did you do anything last year?
I think I actually just took a 20-mile bike ride.
Yeah, you took it really literally. I love that.
Yeah.
I wish I took a 20-mile bike ride. The bike path here is just about open too.
Oh, nice. All the snow's melted.
Yeah,
Nice. I'll have to hit that up.
Yeah, for our bicycle day today, we had a fun team meeting, talked all about our past bicycle days, misadventures, and other exciting things. Yeah. So,
fun stories.
Yeah. Oh, a lot of laughing. Yeah, so it was great. Yeah, today on the show, we have a lot of exciting news to dig into, so we'll kind of get right to it. But I wanted to have you plug the neuroscience course again, Kyle.
Yeah, demystifying neuroscience. So that is going to kick off on May 17th, I believe. Just missed early bird tickets, and so that is going to I think it's like $800, $899, and that is presented by Melanie Pincus, Dr. Melanie Pincus, and Manesh Gurn. It's going to be an 8-week course, a lot of pre-recorded material, and also you'll be able to join them in Zoom to have Q&A, discussion, and talk all things neuroscience. Looks awesome. I actually think I might try to take it just to try to brush up on some neuroscience. So that starts on Wednesday, May 17th. It's going to run from 7 p.m. to 8:30 p.m. Eastern Daylight Time. So definitely check that out. If you're on the West Coast, it's 4 p.m. to 5:30 p.m. Pacific Daylight Time.
Right on. And you just kicked off Vital yesterday, was it?
Whew, yeah. We just kicked off Vital, our second round. We had a little orientation call on Monday. We just had our first presentation yesterday with Dr. Luis Eduardo Luna, which was amazing, really fun. So great to get to know the students so far. So it's been a week. I'm a little smoked.
I bet. I'm for the first time I think wearing my Vital hoodie on screen, which is sweet.
And I got the other different one, the Psychedelics Today one.
And I got the old logo I'm not supposed to be wearing anymore. Zip that up so nobody sees it. So I guess let's get to it. So some hot things that are happening right now, and we're going to cover one of them. The biggest one right now is this whole Church of Psilomethoxin situation, which is pretty fascinating, honestly, but also a little troubling. And long and short, we've had them on the show in the past, Greg Lake at least, to talk about it. He's an attorney helping with plant medicine law out there, and helping people do churches and things like that. So the Church of Psilomethoxin distributes psilomethoxin to its members. They claim that psilomethoxin is created by adding 5-MeO-DMT to the substrate of cultivated psilocybe mushrooms, which is then biosynthesized into psilomethoxin. And samples of the purported psilomethoxin material were obtained from the Church of Psilomethoxin through a donation from an anonymous church member. Yeah, so while I have also had some friends who run kind of sneaky operations out there, and they acquired some through their normal channels, and also had a similar result, like no psilomethoxin showing up in their testing. So, and I'm sure there's other labs doing this as well. So, it's exciting, right? Like, new molecule, there's like some tie to Sasha Shulgin, because we'll get into that in a little bit. And, this group is willing to mail you psychedelics that are ostensibly legal. They tell you they're legal, at least. And we'll get into that in a little bit. But what's your first kind of like off the cuff kind of reactions here, Kyle, to this one?
Well, when I first heard about psilomethoxin, my brain was like lighting up, going like, I'm really curious to see some test results. Like just thinking about the process. So they would add 5-MeO-DMT to the substrate, and the idea is that the psilocybin would then the mushrooms would break it down and then create psilomethoxin. And I was just thinking like, is this possible? I don't know, it just sounded really fascinating. I never heard anything like that before. And I guess I was a little suspect right off the bat, going like, I would love to just see some lab results to know that that's actually happening. But everybody I was talking to is telling me how different it was, like experientially, than psilocybin. But I guess I was just like really curious around, like, I don't know, is that possible? And like, how are we making claims without maybe actually having lab results? So those were like my first initial thoughts when I did hear about this. And yeah, I don't know, I got a chance to chat with Greg a little bit about it too, at Psychedelic, just to kind of like, learn more from him. And yeah, I don't know, it was interesting to just kind of dig into this. And so, yeah, fascinating to finally see some science published about it. And doesn't seem like Psilomethoxin actually showed up on the test results.
So at first, I'll admit my danger alarms weren't going off, but my legal alarms were going off, right?
Me too. Yeah.
I'm like, okay, you're mailing this to all these people, so not only are you at legal risk, but the recipients and like the distributors and whoever else in that chain. Like, it's not clear that this will hold up in federal court, right? So, and I think I even chatted about that with Greg on the show with Greg. And then secondly, it's a novel molecule. We don't have any real systematic data collection. Like, I didn't really see any kind of commentary from anyone saying like this particular molecule is super safe because we know how it works. Like, it's like, okay, let's just jam two things together. It sounds even more spiritual. Like, great, now we have a church, right? And yeah, there's a health risk. And there was some comment in one of these articles, I think it was the Psychedelic Alpha article maybe, where, and we'll link to all these in the show notes, folks, where there was talk about like from molecules like this and similar molecules, there could be for real brain damage, and we don't know. And things should be tested a little bit, especially when they're novel, right? Like, if we have a couple decades of use at scale, we can say, cool, like probably pretty safe, like 2CB, LSD, psilocybin, etc. But, when we have, a year of use with maybe 20 people, like that's not really enough to like think we should super scale that, right?
Right. Mm-hmm. Yeah, and you bring up a good point just around novel molecules, just thinking maybe from, I don't know, more of a spiritual perspective, as you're saying, like combining psilocybin, psilocin, and 5-MeO, like, yeah, what would that create, right? Like putting the God molecule with psilocybin and stuff like that. But yeah, I mean, when we are, creating new novel compounds, what is the safety risk there, right? And yeah, that was an interesting, I'm trying to pull up the quote, but I can't find it, just around other cases where, other chemicals were actually, led to kind of chemically induced Parkinson disease.
Mm-hmm. Here it is. Psilomethoxin is the perfect candidate for a metabolic path capable of wiping out every serotonergic neuron in the brain, very much like the chemically induced Parkinson's by MPTP and hydroxydopamine, and lesions resulting from dihydroxytryptamine exposure. We are not talking about a transient inconvenience. It is irreversible brain damage that is at stake. Yeah. So it's definitely hard, and definitely a little scary. And who knows? Somebody might eventually come out with Psilomethoxin and it's amazing and we'll have real data. Till I have a clearer understanding, like I'm probably going to steer clear. But, I will be watching, and I am curious. And the church came out with some interesting commentary, right? Oh, well, I guess before we go there, USONA published this paper with their, all their resources, USONA being a nonprofit in the space, titled Fungi Fiction, Analytical Investigation into the Church of Psilomethoxin's Alleged Novel Compound Using UPLC-HRMS. So there's the tech gear used. Andrew Gallimore also did a really good summary on his Twitter feed, and we'll actually link to that in the show notes as well. So I really advise you all read this stuff, and also probably read the church's response, and we'll link to that as well. Yeah. And anything before we read these quotes, Kyle?
No, I guess we could probably read into some of the science stuff, right? And what some of the stuff that you sort of put out there. So this is coming from the article. For comparison, authentic reference standards for structurally related tryptamines, including psilocybin, psilocin, 5-MeO-DMT, baeocystin, norpsilocin, and norbaeocystin, were produced in-house by reported methods, and a standard test mix was prepared by adding these to a target screen library and detected based on the high resolution mass for the protonated adducts of each. The samples, this is what those letters you were reading off. So they were added to ultra high performance liquid chromatography with high resolution mass spectrometry. It would be used to determine the authenticity of the samples. If psilomethoxin is actually biosynthesized from 5-MeO-DMT through the same pathway that hydroxylates psilocin, then the subsequent step for phosphorylates psilocybin psilocin to psilocybin via the PSIK may also take place to produce 5-MeO psilocybin. By also examining the potential presence of 5-MeO psilocybin in the sample, the objective was thoroughly assessed the plausibility of the proposed metabolic pathways, which what the church claims, and if present. In the present sample, Psilomethoxin would likely appear with a retention time between that psilocin and 5-MeO-DMT approximately at 1.3 to 1.6 minutes.
Yeah, so I'd advise people read that. Like it's clear they went pretty far, and this isn't peer reviewed yet, and people made a really strong point of pointing that out. And once it is, we'll have a little bit more certainty on these findings, right? Yeah, and then psilocybin and psilocin were readily extracted within detection thresholds, whereas blue trace, corresponding to psilomethoxin, was indistinguishable from the baseline noise. And they have some graphs in their articles and whatnot. So really it looks strongly like there is no psilomethoxin in there. And I don't know if I told you this, but a famous chemist with a TV show told a friend of mine that he wouldn't touch it with a 20-foot pole.
Why is that?
Because there's no safety data, there's no history of use, there's no quality control of any kind, no real trust chain, like if the trust is faith, then like why?
Right.
Why should somebody that hasn't had that faith installed in their software yet be up for it, right?
I guess when it comes to safety, like the way I heard it was being produced was just 5-MeO injected in the substrate, and then the mushrooms would uptake that, and then they would just break the mushrooms down and like pulverize it into a powder. I wasn't hearing anything about actually extracting a molecule. So I was like, is that potentially safe? Maybe if they're using like whole fungi. But then again, what kind of chemicals could psilocybin or the mushrooms then produce?
Fungi can create a lot of really dangerous molecules for humans.
Yeah.
Right? So, the whole pharmacopoeia of, dangerous mushrooms out there. So we've got to be careful. Like, it's not the case that just because it's psilocybin, all molecules that could be generated through their kind of bioreactor, if you will, doesn't mean they're safe. Yeah. Yeah. And one quote from the article here: "Is the church engaging in human testing and hiding behind a flimsy wall that mixes faith with physical chemistry?" This is from Mario. I think let's go to the church's responses here. So we're kind of beating this one up a little bit. So I'll read this guy and then we can comment on it and jump to the next one. So this is from the church's response, and we'll link to this as well. The claims made in the subject article are highly dubious at best. The individuals attacking and attempting to discredit our church seemingly operate off the erroneous assumption that the church has made the claim that psilomethoxin has been positively identified in its sacrament. I don't know about the positively identified part, but I was told it's in there. Had they taken time to read through our website content and other materials, they would have known that their assumption was incorrect. However, these parties seem to be so fixated on attacking and discrediting the church that they have either seen the church's statements and completely disregarded them, as it doesn't support their baseless attacks, or have not taken the time to assess the entire situation before publicly disparaging the church. Either of these scenarios are troubling. Moreover, it is evident their desire to try to discredit and disparage our church has also significantly and negatively affected the quality of their science. The article at issue is based upon extremely poor scientific standards, as demonstrated. Maybe. It'll be peer-reviewed, so time will tell. But, like, in my conversations, we were told this is a novel molecule that was developed, and here you go. And you can buy it right on the website, right? Yeah. Like, the sales pitch wasn't, hey, we're selling, we're a mushroom church, you can buy our shit online. Like, that's not really what I heard, right? Or how would you respond to this whole thing of it being kind of baseless? And it's okay to say we're ignorant because we're not chemists.
Yeah. I mean, that's what fascinated me the most, because I don't have any chemistry background, and I'm sitting here going, like, is this possible, right? And, like, yeah, when I was chatting with people about it, they were making those claims that it was, kind of suggested, hypothesized, maybe validated by Shulgin, and really kind of relying on some of that old research or maybe hypothesis around it, and that was happening. But I don't know. Yeah, I don't know anything about chemistry really. So when I did talk to somebody about, like, the legality of it, they were kind of talking about this new novel molecule, but I was also
like, that's not scheduled. There's no analogs. Therefore, the Federal Analog Act can't go right.
Yeah, I thought maybe the Analog Act could have gone there, because you're dealing with, like, kind of similar substances with, like, 5-MeO, but I know it's a new novel kind of synthesis of stuff. But yeah, I don't know. It's just been really fascinating.
Right, and wild, right? Like, this is an interesting response. Like, it's worth noting that 2 of the church's founders are attorneys, and they're gonna put out some decent legal defense of themselves, right? Yeah. And hear me out, everybody. I am actually super into people being able to purchase mail order drugs, mushrooms included. So, like, I'm not faulting them on that. I think it's edgy and scary, legally scary, but if they're willing, if everybody's consenting and has informed consent, like, fuck yeah. But they might not. And, like, you're exposing yourselves to risks when you're ordering this stuff across state lines.
Well, the one thing that, like, after reading, the church's responses, reading some of the research, the one thing that I kept coming back to, is this a product of the war on drugs? Right?
100%.
And it's like, we're trying to find these loopholes for religious freedom. We're trying to create new novel molecules that may not fall under the Analog Act. And, it just comes back to, why are these substances illegal to begin with? And, in the United States, we do have this really interesting religious freedom protection that most other countries don't have. And people are really kind of trying to leverage that. But, if the psilocybin, psilocin, and these other molecules weren't illegal, would this even be a thing? Would people be taking the extremes to try to, I mean, yes, people are going to create new novel compounds, but would they be creating a church around it? They probably would have just been using 5-MeO and psilocybin, right? And so, I mean, the first thing that I just keep thinking about after this whole thing is, like, this is just a product of the drug war, and people needing to innovate, and just how silly it is, right?
It's really complicated, and like, we would just be eating mushrooms and LSD if we didn't have to, deal with this whole war on drugs thing. And like, that's what's happening here, 100%, no doubt. And the church angle is an angle, and people, I think, can and should leverage this church angle. And on the podcast, if people go back and listen to the Greg Lake podcast, they'll actually see that we get into this, like, about consent and how members should be informed about the legal risks, right? Because UDV Santo Daime, you have federal protection there, and you're good. it's not necessarily the case with any other church. Like, you can set up the stage where you might be able to defend it, but you can't promise that everything you're doing is going to be, yes, something can be legal and you can still go to jail, right? People should read the book, You Have the Right to Remain Innocent, if you want to learn more about that. It doesn't matter. The establishment can put you away for all sorts of other things. So, yeah, we need loopholes, no doubt. My point is, like, consent should have been going on here, and
right.
They should be disclosing regularly that, oh, hey, we actually don't know if this exists, because the way they were operating suggested they knew that it was there.
Right. Yeah, and the consent piece is really big. I mean, I've been hearing this throughout the years, people going to different ceremonies and not knowing what they're ingesting, right? Like, people are like, oh, they gave me this chocolate bar and they told me it was like, chocolate ayahuasca. And like, people should know what they're putting in their bodies, right? Instead of just like putting like a blank statement, like, this is chocolate ayahuasca. Like, well, there's so many different brews of ayahuasca and so many different kind of admixtures. Like, are you taking that and infusing it in chocolate? What's in there? Like, because health reasons, right? What do people like need to know about what they're putting in their bodies? I think that's super important. I don't know. Yeah, that's always kind of rubbed me the wrong way, where people just like really spiritualize everything, and they just like put some of this stuff on a pedestal and don't really always like say, like, actually, no, this is what it is, right? It's like, oh no, this is just like something, we're framing it this way. And it's like, I don't know. Yeah, you should definitely have consent of knowing exactly what you're putting in your body.
So, like, perhaps Psilomethoxin is in there just at really, really, really low levels that are undetectable or something, right? Who knows? All right, so the next quote here. Any person or organization, and this is from the church's response, any person or organization which seeks or attempts to open and or increase access to psychedelics beyond the control of capitalist gatekeepers is seen as a threat to their monetary interests, and, as we have seen, causes these capitalist gatekeepers to go to great lengths to try and oust the threat. These companies will spare no person, entity, or expense in protecting their IP interests and exclusive control over new psychedelic compounds or any and all aspects of psychedelic therapy. I don't know, like, because this is pointing the gun back at USONA, right? Like, USONA, like, pretty great organization. They've been leading the charge for a long time. I do know there's some hyper-capitalists in the mix there, like Carrie Turnbull, for instance, and probably plenty of others if you go look at their board. But, like, to suggest that this research was undertaken to limit access further, like, I don't know. Like, it seems a little iffy. Like, to me, again, there's a public health issue here, based on what was marketed and sold. And then, and again, I haven't read all the church's websites to Greg and Ian's point on their comments earlier, but really, like, they told us it was in there. They told us this is what we were buying, and they wouldn't send whole fruit bodies too, by the way. Some of my contacts were trying to get whole fruit bodies.
Interesting.
Only pills, like powdered powdered material in pills.
Interesting. I don't know. This quote is interesting. I mean, I think it just kind of highlights what's been going on in the psychedelic world for the past like few years, right? As more biotech companies come in, more companies are trying to protect IP. Do they take it as like this research of analysis is trying to like just downplay what they're doing, and are they suggesting that there might be some sort of like IP play here with USONA if they're like
there's some screenshots like in their document. We don't have to read it right now, but there does appear to be some patents going through around using mushrooms for biosynthesis of novel molecules and different manufacture pathways. So there's something happening here in the patent landscape. So yeah, for sure, like, there could theoretically be a risk. To me, like, that's not the reason to beat up a church,
right? Yeah,
and like could have, I don't know the answer to this, and some attorneys should shoot us a message at info@psychedelicstoday.com. Like, can a church, for manufacturing its sacrament, be legally held accountable for IP issues? I think it's a really interesting question. Like I'll remix the Bible and copyright it or something, right? Like, I don't know. It's interesting. Like, you can't really do it. And let's go ahead and make an analogy here, right? Like the wafer and wine thing in the Catholic Church. Like, I haven't seen any lab results showing that like the blood of Christ is in there, right? Like,
right.
I would love to. It would be fascinating. I'm open to somebody showing me that, especially if it was done in multiple sites of reputable organizations. But yeah, like how we should use that same logic, right?
Well, when you bring that up, it just like makes me think about just humans in general and how a metaphor like that can be really transformative to somebody, right? When they do engage in that ritual and that metaphor, or I don't know, maybe people really take that as like a literal kind of interpretation of it. And does it actually have transformation?
Some
right?
people take it literally. Some keep it metaphorically. Like it's literally the same quality. Right?
And so, what is this debate between like religion, spirituality, and science, right? And I think that is really interesting. Like, could you go after the church and say that's not the blood of Christ, right? That's just wine. But obviously, it's much different here, right?
Oh, totally. It's a different type of safety concern for sure.
But if you are kind of, I guess idolizing something, you're, praying to something, and if this is the sacrament that they're using to get in touch with their spirituality, where does that fall on science and then just like religion?
Right. Oh, okay. I'm seeing what you're saying now. Like, perhaps their faith argument holds up.
Well, that's what they're saying in here is that they never I forget where the quote is, that they're basing it off of faith, right? So if you believe in something so much, can you create a religion around it? Like what was that guy with the spaghetti monster? Like
flying spaghetti monster, it's great.
Flying spaghetti, and he was able to get his license taken with a crazy pasta strainer on his head or something like that.
Pastafarians.
Because the belief is there, the faith is there, right? And it's like who says you shouldn't believe something if there is a very hard belief around something, does that fall under religious freedom? And where does science get to say where they get to step in? Obviously, I don't know if there is a safety and public harm, like a public safety issue here, then I think yes. I don't know, this is tricky.
This is where my mind just I want to say things that I shouldn't say on the podcast, right? Like I'm trying to be nicer. But yeah, like so if Psilomethoxin is there and there hasn't been any human trials done on it of any kind or animal trials even, then like perhaps we need to tread a little more lightly. And I kind of wish I caught that earlier.
Right.
And like the FDA process is onerous and often ridiculous, but it's there for a reason.
It is to protect people, protect consumers, right?
Doesn't always work out that way, but for a lot of reasons. But at least having a bunch of published data, I think that would be really good to prove safety and to say, cool, like let's go forward. And it's interesting. I'm really curious to see how this shakes out. I hope everybody's okay, nobody got hurt, and nobody goes to jail. But I think telling the truth, doing this caveat emptor thing, like buyer beware thing, and who can you trust out there? That should be something we all think about a lot. The Tim Leary line, think for yourself and question authority, is one of my favorites for a reason, because even, what's the line? Never meet your heroes, because they're going to disappoint you.
You realize they're human and they don't always live up to your expectations.
And sometimes it's really bad relative to your expectations, right? And sometimes it's fine. Sometimes it's great.
Well, sometimes it's just humbling. You're like, oh, this person is just a human and they have their flaws and they're not perfect and stuff like that.
Yeah, exactly. So, I wish everybody well here. I would urge people to play nicely with each other in the sandbox, like from the church and from outside the church. And hopefully we can continue to make progress towards religious freedom here. Like I want a lot of churches. we at PT have done a lot of work around the church topic to hopefully get people inspired to go forward and start churches. And likewise, I'm pretty extreme. Like end the drug war immediately, make safe supply available immediately. So far as, and I've said it too many times, but like I want to be buying LSD at Walmart without a script, and like I almost have to stop saying that soon, but like it's real, and I kind of believe it. It's just going to be 80 years out, like, but I have to act like it's 2 years out.
I'm sure there's lots of people that probably don't want their LSD from Walmart, but
buyer choice. Buyer choice. You can pay 50% more at Whole Foods. It's fine.
Oh, there you go. Whole Foods.
Yeah, Bezos brand.
Yeah.
If you like Bezos, you can buy from him. Like it's a whole ball of wax, and we need to like be carefully, understanding the story and looking at both sides and understanding their argument, but also being critical too. Like we should be critical almost everywhere of what we're told.
Mm-hmm. Yeah. Yep. Yeah. Very important. I don't know. Just something else that just popped in my head, just around like consent and religious freedom and stuff like that, and just thinking about all the different brews of ayahuasca, right? When people consent to go to an ayahuasca church,
what are you consenting to?
If they go to an ayahuasca retreat, like, hopefully they get told like, oh, tobacco's in here, this plant's in here, but like how many times that maybe doesn't happen, and people just aren't getting copy vine and chacruna, they're getting lots of other things. But since it is embedded in that kind of spiritual shamanic framework, it's like people don't even question it, right? It gets a free pass. They go, oh, okay, like I'll take this, and oh, like this had really great purgative effects, right? And they had such like really great like master plants. But I mean, what happens when somebody gets dosed with toei with ayahuasca? Didn't know
far too much nicotine. Yeah, has a heart attack. Yeah, and
it's interesting that seems to get a little bit of a pass here.
It's not going to win us any friends having this conversation, and there's also food safety issues with ayahuasca too. Like they, in many of the ayahuasca traditions, they age ayahuasca a lot after it's brewed. To me, that's a monstrous food safety issue because it'll mold like crazy, and before serving it, it gets boiled. They skim off the muck and then they serve it. And to me, like from an American perspective, I used to get food poisoning all the time. Like I think it sounds like a nightmare to me. And we brought it up to others, and they said, the rest of the world can't live up to our
standards.
No, there's sterile American standards. I'm like, well, there should be some baseline, but I'm not saying the tribes and the original people down there shouldn't like keep doing what they're doing. I'm just saying when interfacing with the West and people without a really robust gut flora as they have, and we're not as resilient. Yeah, and there's some real issues there. So the toei thing, the nicotine thing, the food safety thing. There's a lot, and this is ayahuasca alone. Like I'm sure we could go further on other things.
Yeah,
but like we really. Let's try our best, all of us, to be super safe so there's no more bad news out there. And that helps us end the drug war. Mm-hmm. Right? Yep. And if we can resolve things well and quietly, hell yeah, let's do that. If we need the media involved, let's do that too.
Yeah, because we're all victim of the drug war. And I think like anything to push against that and fight against it, I think is really important. Just think about all the harm that's done, injustice, and it's just terrible, right? This, I think having some science out there too is good for public safety. So, if somebody did have some bad experiences, like how could that, blow up, and then, people can spin it in all sorts of different ways. And then maybe try to attack the religious model, right?
Exactly. And I want to defend the shit out of the religious model. I think it's super important. There's, we don't have time today to go into the Colorado issue, but there looks like there's some pulling back from the really robust law reform. How do we want to put that? Protection for ceremonial use in Colorado that exists right now.
Oh, really?
It's pretty wild.
They're trying to fight it. I haven't heard this.
Yeah, the Senate president of Colorado is introducing a bill that radically changes. My phone has been blowing up all day. Wow. Like to the point where I'm almost like, I need to cancel all my plans and go to the State House tomorrow.
So is that pushing against kind of like that decrim model that they just passed and all that?
You have to lock up your San Pedro when you're growing it. No more than a 12 by 12 room, and mushrooms likewise. And like it's pretty wild. But a lot of great people in Colorado are on it. And what would be funny to me is if this was the thing that brought all the sides together in Colorado. But we'll report more on that soon, everybody. There's plenty of articles out there on it. But yeah, let's keep rolling through this stuff. So Time Magazine, time.com, the latest promising long COVID treatment, psychedelic drugs. Yeah, it's like put some tussin on it.
We've been hearing this for a while, though,
Totally.
from like people coming and reporting stuff to us. So it's cool to actually see something like this posted.
Totally. And there's some really cool speculation and case studies. So Dr. Joel Castellanos at PHRI at UC San Diego. PHRI is what? Psychedelics Health and Research Initiative. He's been on the show before. He's a collaborator with Court Wing, friend of the show. Yeah, and he did some really great case study work here. So Renee, 53, suspected case of COVID-19 in 2020, lost her smell, had a rapid heart rate, dizziness, ringing in her ears, brain fog, psychosis, hallucination, and suicidal thoughts. And she tried microdosing. Like, that's horrible. But then I'm like, microdosing, huh? And then cognitive function and creativity improved. Started to feel connected to humanity again. Had emotions again. Had some joy. Felt normal. Yeah, and when you can be like crippled for more than a year, like I had this at home. Like it was
you went through it.
It was one of my least favorite experiences, and it's why I reacted so strongly for like masking and whatnot, because I just saw how horrifying this stuff was in my own home. It's not great. Yeah, so Joel Castellanos, associate medical director at PHRI, and he says he hears from many long COVID patients who have either tried or are interested in psychedelics. He's currently working to publish a case study about one patient who saw dramatic improvement in their fatigue, headaches, depression, and brain fog after using a combination of psilocybin and MDMA. Have you met Sue Sicily yet?
I haven't, no.
She's so cool. We got to go to Phoenix to visit her lab. She's the first person to ever successfully sue the feds for their cannabis monopoly, and has some really interesting stuff going on in Phoenix. She's a physician. Dr. Sue Sicily runs the Scottsdale Research Institute in Phoenix, and works at a community long COVID clinic. Believes psilocybin may help long COVID patients by stimulating neuronal connections and tissue growth in the brain and reducing inflammation throughout the body. And she points over to Charles Nichols and his research showing anti-inflammatory effects in rodents. Many believe long COVID symptoms are from inflammation alone. I think it's a lot more complex than just inflammation, but like inflammation, like in my mind, has to play a part.
I think there's a new study that they're learning more about what long COVID is. I just came across an article a few days ago. I didn't read the whole thing, but I'm fascinated by what the mechanism there is, because I do know a lot of people that struggled with it, and sometimes it's scary. I mean, I had that weird heart palpitation thing for like 3-4 months after COVID, and I was like, ugh, like what's going on here? This is weird.
I get that every night when I lay down. I hope it's not COVID, but who knows? So Sue recently advised lawmakers in Arizona on HB 2486, a bill working its way through the Arizona state legislature, which would provide up to $30 million in research to research the therapeutic potential of psilocybin for 13 different conditions, including long COVID. And what's great there is Sue operates as a nonprofit and could probably access a lot of those funds, which would be amazing.
And she's one of the few that has like a psilocybin producing license from the DEA, right? Something along those lines.
Like a top tier DEA license, DEA Schedule 1 maybe, and she's got all the infrastructure set up, and I think she can manufacture LSD and mushrooms, which is really fascinating. So we'll see. We'll see. I let her know I'm happy to be a clinical trial participant. Yeah, and we'll see. Like I'm really hopeful. And Sue, for what it's worth, tangentially here, She's also been appointed by the governor of Colorado to the psilocybin advisory board, which is great because Sue's been around for a bit. And yeah, this Dr. Selena Subaya at Columbia University Irvine Medical Center, who also has long COVID, is launching a small pilot to explore whether a single dose of some sort of psychedelic can relieve long COVID symptoms. Participants will receive a psychoactive compound, then they will track them for 2 months to see if their symptoms improve. Yeah, like there's a lot of money going into long COVID research, and this is just like, a branch of it, which is great. Like there's a lot of money on the line for culture as a whole if we don't sort this long COVID thing out.
Right. Yeah. Just thinking about the people, the suffering, people not being able to work and continue their lives as they normally would. I was just chatting with somebody like some of their brain fog is just really kind of holding them back, and like, memory issues and stuff like that. I think they ended up getting it kind of like back to back. But yeah, it's scary. Like, what kind of impact does that have on society if like people are like out because of like what they're going through?
We're already doing that with the drug war, prisons, and much more. So I think we can do a lot better.
So yeah, I don't know, and it's cool to just see that there's kind of like this new novel approach to psychedelics with something like long COVID instead of just looking at the mental health application of it. So it's cool that it's kind of, there's people out there looking at kind of like the physical aspect and physical health and how that could help out. And yeah, I mean, we've chatted with a bunch of people either sending us emails or just, I don't know, I've heard people just say, hey, I started like, microdosing psilocybin or taking like, doses, and I got my smell back, and that's really fascinating to hear that. I think my issue with the microdosing thing is just terminology. Like, are people taking like museum doses or like beyond the sub-threshold doses and calling it microdosing?
This is perpetually going to be my issue with microdosing.
Yeah,
it's like we have to call it what it is, and we have to figure out, like, have some sort of consensus on terms. Otherwise, we're all just speaking nonsense to each other. Like this girl in Boulder, a friend overheard, yeah, we're going to go microdose tonight. We'll just split an eighth. And it's like, it's absolutely not microdosing. No. But for a young person in Boulder, perhaps, I don't know. It's, so we need to figure that out, and like, let's talk dosing. And it's hard. It's a really hard thing to do, especially with mushrooms, but
totally. Yeah.
We'll get there. So, next up, Marijuana Moment. Headline: majority of Americans back legalizing psychedelic therapy and federally decriminalizing substances like psilocybin. It was a pretty big number, right? Like 60?
So Breakthrough Bulletin conducted a survey of 1,704 voters nationally. Majority of likely voters, 60%, are in favor of giving adult access to regulated psychedelic therapy. 72% Democrats, 5% Independents, and 4% plurality of Republicans. So yeah, it's interesting that it's very skewed on the Democratic side, and I don't know. I also just kind of laughed at majority of Americans, and then the number is like 1,704 voters. I'm like, that's also a small number.
I don't even know how many people are in the country anymore. I don't know like what sample size you need before like you can actually extrapolate. Right. I think you need a lot more than 1,700. But that bodes well. What doesn't bode well in my mind is the 72% Democrat number. It's like you're probably inclined that way anyway. And like only having that many Republicans, that's not really great. Like that's not a good sample set of what we have nationwide here, right? When the poll provided additional context about emerging research into the benefits of psychedelics for mental health conditions like PTSD, depression, and anxiety, as well as the FDA's decision to designate psilocybin and MDMA as breakthrough therapies, 68% of respondents said they back reform to allow psychedelic therapy in regulated settings. In this one, you got 72% Democrats, 67% Republicans, and 64% for Independents. 18 percentage point jump for GOP. So pretty solid. And this is my experience at when I was in Congress there, of like lobbying a little bit. Like they're a little dubious, and then all of a sudden you start throwing out figures, and they're like, "Oh yeah, for sure, I'm down." And it's that's how people want to, be spoken to, not just opinions. And
right, and then just also hearing like the stories that people can really resonate with, right? Like of hearing everybody probably is impacted by some sort of like mental health issue, right? And like hearing the potential here for like a new mental health treatment is really big. I mean, I think I don't know if I mentioned this on the podcast or just mentioning it to you, but when I was driving through Nebraska to come out here to Colorado, I stopped in some little small town, and somebody was reading the email off, and they're like, "Kyle, what do you do for a living?" And I told her, I run a psychedelic media and education company, and just talked a little bit about the mental health benefits of some of this and what the research is. And they were just like, "Oh my God, we need new like tools in mental health. This is such a big deal." And, I was not expecting that from where, and, obviously they're in the hospitality industry and maybe they were being nice, but, body language too, you could have picked up on like, something.
Yeah. They're in hospitality, and it's not necessarily known as a great place for mental health.
Right. Yeah, that's a good point too. Yeah. Working long
like
hours.
Rural communities, crazy substance, gambling, whatever issues. Like mental health everywhere is kind of like tragic, right? And we don't want to read everything here, but like at the final point we pulled out, 60% of folks polled do not think that lawmakers in their state are focused enough on mental health. Yeah, I wholeheartedly agree that we are not doing enough as a culture to deal with mental health appropriately. And, maybe that's something we should tackle at some point. Like what's our, 20-point program?
Right. It's a big issue to tackle, and there's so many different ways to slice and dice it and approach it. But, I don't know, it's interesting just to think about like, I think we might have read this on the podcast before, but there was an article, a research article that came out that's saying that the pandemic actually didn't exacerbate people's mental health. But I feel like the mental health narrative really shifted during the pandemic. And I thought that was like kind of interesting to read, that like people's mental health didn't necessarily get exacerbated as maybe we were making it out to be. But, I think the pandemic also really kind of shifted the narrative around mental health treatment, because I think more and more people started to seek treatment and like be okay with it, especially since the pandemic.
Yeah. I think that could explain the Adderall shortage and many other things.
I just think
in part.
Yeah, just thinking about like all my colleagues and friends that are therapists and just completely maxed out, people not actually being able to get a therapist because there's just like nobody available, and how many people were just outreaching for support.
Yeah, for sure. That's interesting. And I do appreciate that point. Like the narrative has shifted 100% around mental health, and COVID seemed to be the pivot point for us. We might have to come up with a different term than mental health too. Anyway, moving on. Forbes came out with an article by Andrew D'Angelo, brother of Steve D'Angelo, famed cannabis dude. Bicycle Day may soon overtake Cannabis Holiday 420. And I found that really interesting. And I like the article. They did some good stuff here, but yeah, like cannabis still has this crazy stigma, and psychedelics having been in the closet for 50 years. Like the stigma wasn't there to accrue as much as it was in cannabis, right? Yeah. I find that fascinating. And people are really pumped on psychedelics right now, obviously.
It's really fascinating. Yeah. I mean, well, and just even thinking about, I know we've mentioned this before, just how much psychedelic research there is versus cannabis research. I mean, mostly just because of the weird monopolies and laws on cannabis within the governments. But yeah, and I don't know, maybe there's like a shifted narrative, right? Of like, people are really finding healing through psychedelics, and they're like maybe more apt to come out to talk about it versus, I don't know, maybe just using cannabis more recreationally and chilling. And I think you still kind of have that narrative of, you know, the typical stoner that just like hangs out and gets the munchies and, you know, is kind of, you know, just chilling, versus people that are, I think, more vocal about their psychedelics. I mean, they're talking about healing their trauma. They're talking about like really transforming who they are and transforming, the trauma that they've been through, their mental health. And I don't think maybe you had that as much in cannabis. I mean, you definitely had it for like, you know, people suffering from like epilepsy, cancer, and you did have some of the mental health benefits of cannabis and people being very vocal about that early on. But almost, I don't know. To me, just not in the way that psychedelics are being spoken about. I don't know. Do you? I feel like you've been in the cannabis industry for a bit, or just surrounded by it, living in Colorado.
Like the backlash that I saw when I was around the cannabis industry here in Breckenridge, it was crazy divisive. You could not convince these people with data or otherwise. And yeah, like the data around cannabis generally, especially recreational cannabis, we'll call it loosely, bunny ears there, folks. Like, yeah, it's not there. Like, it's nowhere close to matching the conversations we have publicly about psychedelics, right? Healing, religious experiences, connection, better relationships. Like, we don't really have that conversation publicly around cannabis.
Right. Well, even just thinking, we just saw Dose 2 the other.
So good.
Yeah, it was a really, really great documentary. If it's screening anywhere in your city, definitely go check that out. But, you know, it did focus on psilocybin, and then there was also that piece about cannabis. And cannabis has seemed to play a big role in, like, you know, this person's healing journey with cancer and maybe shrinking tumors, right? And that's big. But then it was also, like, the psychedelic piece touch something completely different in like transformation of like being comfortable with death. And I don't know, maybe that takes a spotlight a little bit more, but I don't know, like hearing somebody take Rick Simpson oil and then their tumors start to shrink. I mean, that's pretty big. That's a really big story. But then, this big focus on confronting death, confronting cancer, feeling okay with it, just wanting to live. It seems like that almost feels like a much more kind of powerful narrative to some degree, just coming to terms with life and death.
We'll plug just because we can. We had a couple students in there, and it was really awesome to see what they're up to these days. So just cruising through. For many, we think of Bicycle Day as kind of like a coming out celebration. Like celebration, I think, is the right term for it. So our friend Dennis Walker, who blogged for us recently about conferences, says Bicycle Day is a chance to celebrate my identity as a psychonaut and a champion of cognitive liberty. And he does a puppet show too, it says here.
I had to stop when I saw that. I was like, wait, Dennis, the Psychedelic Puppet Show creative director? What is that? And
did you not see the photos? He came over and showed me the photos. He had a puppet of himself. And
actually he did. I guess I just forgot about it. But when I read this article and saw that title, it's like, what is he up to now? That's awesome.
The quote finishes, "For so long I've had to hide this part of who I am, and now I get to unabashedly share it with the world." Totally. So this is an interesting one from a different story. Music and sound healing duo Jenny Devo and Seth Misterka of Dynasty Electric had the, quote, most amazing LSD trip of our lives, quote, on top of a mountain in the Monte Verde cloud forest of Costa Rica. Up there, sitting on top of the world, it felt like the veil between the mystical and the mundane had completely broken down. A golden scarab beetle crossed right in front of us as our thoughts formed into clouds and new weather systems. When we came back down from the mountain, we learned that Albert Hoffman had died that day while we were having our otherworldly trip. They haven't felt like doing LSD since. Like when you have that kind of big experience, like it is sometimes the case that you don't want to go back, and sometimes for really good reasons.
Yeah, I mean, I think I'm just thinking about some of those like really potent experiences in like my early 20s, and it's like that was interesting. Do I want to go back and explore that? Like that gave me enough to chew on for a bit. And yeah, I think that's just the power of these substances. I always think about something Jeremy Narby said in our interview. He's like, ayahuasca can give you so much content to work with that would take years to like really unpack. Like, why do you need to do it like every weekend? And there's something there, I think.
There's something to feeling spiritual.
Yeah, like embodying, right? And like bringing it down into the world.
Exactly. How do you get it anchored? And yeah, there's a lot there. Yeah, so can we use Bicycle Day as a leverage point for lobbying? And yeah, how do we really try to bring this movement forward in the way we want to see it moved forward? Yeah, there's a lot to this Bicycle Day thing. I love that Bicycle Day is about LSD, because it's not included in most narratives around drug reform. And I think it should be. I think it should be included, like decriminalize nature. It's a plant platform. It's not anything to do with LSD.
Well, even like the Thank You Medicine kind of initiative that got set for a while ago. And
I'm going to strain my eyeball at some point when people are rolling my eyes so hard from hearing plant medicine over and over again, when what they really mean is psychedelic compound. And they're just afraid to say it or something, or they want to like privilege plant-based modalities in their speaking, right? I don't know. It's something that I've always had a problem with, and I've probably talked about it on the show plenty already.
But just thinking about the importance that LSD had in shaping the culture, shaping kind of like early psychiatry, the discovery of LSD along with the discovery of serotonin really brought forward this like new kind of approach to psychopharmacology, and so I think there is a lot to be celebrating there, and something that our teacher Lenny has mentioned, and I think maybe we wrote about this in that article in the Philosophy of Psychedelics book. This is one time in human history where you're able to mass produce a psychedelic at scale because of the potency, where you didn't have to go out into the backyard, go on an adventure to go seek it and harvest it, or having to grow it. Like the amount that could have been produced and at scale, and the access that people had was unlike anything that people ever had access to, which I think is kind of fascinating. And what type of obviously it brought it was so tied up with anti-war movement and like everything, and it really, that whole time was probably very chaotic to live through, but the power of it, and that is kind of in like Western history, and this is something that has I don't know, you always bring it up, like what's Western, like what are our Western medicines? MDMA, LSD, and sometimes they get shamed. Maybe not so much, MDMA, but recreational, like LSD.
There's MDMA shaming out there.
Oh, that's true.
I hear people say MDMA is the only one that should stay scheduled. I'm like, get a grip. Like, people should still go to jail? Cool. Like, no, that's ridiculous. So here, you had a really interesting interview last week with Victoria. Can you share a little bit about that and how that ties in with Bicycle Day? Yeah,
so we just released an episode on the 18th. We released it on the eve of Bicycle Day, and that was with Alex and Allison Gray, which was super awesome. And they go into their story and their history with LSD, how it shaped their art, how it changed their lives, and it was just really an honor to have them on and hear how powerful those early sessions really were. Alex shared a pretty personal story on how it really saved him. Like, maybe he wouldn't have been here if he didn't have one of his experiences. And yeah, it was really humbling just to have them on. Feel like we've always wanted to have them on, and it was cool to kind of have it in collaboration with like this bicycle day thing. And so yeah, I think if you go over to our Instagram account, you'll see some bicycle day themed art that we're sharing on there, and Alex and Allison actually contributed, I think, to it. They sent some art in, which was cool.
They were the first to submit, maybe.
That was awesome.
Which is wild.
Yeah, thank you, Allison and Alex. Yeah, I think we were all shocked. We're like, wait, they're submitting art to us to share on Bicycle Day? Like, whoa, what's going on here? That's cool.
Amazing. Yeah, and the YouTube's worth it if you want to check it out there. It's probably the best place to watch that episode and listen. I'm kind of running out of time, but we'll like kind of cruise through this kind of quickly. These last two. So, The Guardian put out a really rough article on the state of ketamine. It seems like a really anti-drug newspaper, and like it seems as though they had their opinion set before they went out and wrote this one. I don't know. Like, yes, there's some kind of well, I'll read the title. Ketamine clinics have emerged across the U.S. They're already going bust. And Guardian's a British journal, I believe, or newspaper. It's kind of highlighting Actify, neurotherapies, and KWC, but it touched on a lot of people. Like our friend Lauren Taus got in there. Natalie Ginsburg from MAPS got in there. And, you know, the language people use to critique at-home ketamine just seems over the top to me. Like, and we should be separating all these topics, right? It kind of got clumped. The at-home thing got clumped in with Field Trip and like ketamine wellness centers closing a lot of their clinics. And I think we really need to separate those two things and examine them carefully so we can come up with good conclusions. Like, I think at-home ketamine isn't terribly important. And yeah, there's issues with some of the ways it's getting prescribed, but like it's saving lives actively, even if it's not rolled out perfectly. And even the infusion clinics, yeah, they're subpar, but they're probably still saving lives.
Yeah, definitely. I mean, I've heard plenty of times of, people going in and it's saving their lives. I also heard the opposite, where it's like, terrible, or people got stuck in a really bad experience and didn't have the support. But, I think it's a risk, benefit analysis, right? And I remember we were chatting with somebody early on during the pandemic and how they were like, yeah, people are going through like a shit show right now. And if ketamine is available for like at-home prescription and it could help somebody with their depression or their suicidality, why not have that in the medicine cabinet for some folks? And I think it just comes down to consent and really teaching people how to properly use this. I read this article like last week or something, 2 weeks ago when it came out. I don't really remember everything in there, but I think somebody was saying, it just feels like they're glorified drug pushers, and maybe some people are looking at it as a way to make profit, and it's easy right now to administer ketamine at home. But I think for some folks it is life-saving, and we shouldn't really dismiss that. But yeah, right here in the article, they're saying some of the reasons for closures: premature expansion, delays to health insurance coverage payments, and investor impatience, which, yeah, I mean, all kind of good points, right? Like, I think the premature expansion, people getting really excited, people coming in maybe not really understanding all these different use cases and maybe how to properly create a container around it. Obviously insurance coverage, that's a big thing. It's very inaccessible to a lot of folks, but I think some of the at-home stuff is, some people can get a good price on it, and that makes it a little bit more accessible. But yeah, people not being able to use health insurance to cover their treatment, that's going to be a big issue. And then obviously investors probably want their returns, and they're trying to expand too quickly and not really. And I mean, especially, I think we mentioned this before, but Field Trip trying to expand during the pandemic, other companies trying to do that. It was a kind of shitty time. There's a lot of factors here.
And a lot of these people were riding at not just the peak of psychedelic excitement, but like the peak of cheap money in the economy, and the peak of like the economy for a while. Like things were riding high for the last bunch of years, and like those things, yeah, they all just converge at a certain point and shit goes down. Yeah. So I don't know, like we're going to see a lot of, bumpy stuff here, but I just really didn't dislike the tone of this article, and thought there was a lot of really kind of immature opinion there, because there's this whole thing about people needing to go in person to get screened for these drugs, and it eliminates so many people that live in remote areas from getting services that could be life-saving or life-changing for them. When I talk to people who live in Alaska, sometimes they have to go 8, 12, 24 hours to get treatment. And that's not practical. It doesn't work when you're sick. And to suppose that everybody should have to do that every couple months, which is like the whole Ryan Haight thing that's going on, like pulling that back, like it's ugly. Yeah. So yeah, and we are going to have some serious issues in the business space. Like people are going to keep failing. And we've been talking about this the whole time. Like psychedelic biotech's a hard gamble. I wish them all well, because I would love to see gazillions of new drugs in the pharmacopoeia, but it's TBD, really. Yeah. So, and finally, a fun one. Snoop Dogg microwaves his blunts before smoking, and for a good reason. Here's why.
I don't think I came across this article. This is
from
the first
Benzinga.
time seeing it.
So, it's a long and short. It's like decarboxylating the cannabis before he smokes it to maybe free up some THCA that doesn't get converted to like delta 9 THC when you smoke it. So like that's the long and short. It's a funny article. They framed it in a pretty funny way, and they're like, do we really want our weed stronger? And they're like, we would have asked Snoop, but we already know what he was going to say. Right. So it's like, yeah, it's an interesting way.
But I mean, doesn't
microwaving your blunt for 11 seconds to decarb it?
But decarbing it's happening anyways. Like when it's ignited.
Is it complete decarb? Is it partial decarb? Like we don't know. I would say there's a taste test or smoke test in the future that needs to be run. And yeah, we'll see. Man, hopefully it works on a joint just as well as a blunt. Yeah. I
mean, I've microwaved it in the past to make those firecrackers, and yeah, that really works.
Yeah, so who knows if it's real. Snoop is way richer than me. I don't think he'd be wasting time, but perhaps. And if we run any tests on our side, we'll report back on this one. Cool. Anything else you want to shout out?
No, I think that's it. I hope everybody, I guess you won't be listening to this on Bicycle Day. I'm hoping that you had a nice bicycle day and maybe attended a fun event or celebrated in any sort of way. And yeah, so happy bicycle post day.
Yeah, recovery time. And check out our neuroscience class, psychedelicsday.com, if you want to learn more there. And what else? We got a microdosing masterclass, navigating psychedelics, and much more. If you want to learn about our books, check those out at psychedelicsdayshop.com. All right. I think that's it.
All right.
Thanks, Kyle.
Thank you. Take care, everybody.
See ya.